Now we'll discuss about the composites. Coming to the definition of composite, the composite resin is a three-dimensional combination of two or more chemically different materials with a distinct interface between them. In combination, the properties are superior to those of the individual components. This is the definition of the composite resin where the Dr. Bowen who formulated the BIS-GMA resin. Now we'll see the classification of the composite resins. Based on the mean particle size of the major filler, the traditional composites are the conventional or the macro-filled composites, which is having the size of 8 to 12 micrometers. And whereas for the small particle composites, it's about 1 to 5 micrometers. And the micro-filled composites contain 0.04 to zero point 0.4 micrometers, whereas hybrid composites contain zero point 0.6 to 1 micrometer. Based on the filler particle size and distribution, they are again classified into the mega-filled composites, which are very large fillers, and the macro-filled composites, which is 10 to 100 micrometers, mid-filled composites, which is 1 to 10 micrometers, whereas the mini-filled composites, it's zero point 0.1 to 1 micrometer, micro-filled composites, and the nano-filled composites. Based on the method of polymerization, they are the self-cured composites, light cured composites, dual cured composites, and the staged curing composites. Based on the consistency, they are light body composites, medium body composites, and the heavy body composites. If you come to the composition of the composite resins, the basic components of the composite resins include the resin matrix, fillers, coupling agents, activator and initiator systems, inhibitors, and optical modifiers. The resin matrix is a continuous phase to which the other ingredients are incorporated in it. Basically, the resin matrix is composed of monomers which are aromatic or aliphatic diacrylates, such as bis-GMA, UDMA, or the combination of bis-GMA and UDMA. If you come to the fillers in the composite resin are usually a type of glass such as quartz, silica, and barium glass. They added to improve the physical, mechanical, and optical properties of the resin matrix. They also help in improving the properties of the resin matrix, such as lowering the polymerization shrinkage, increasing the compressive, tensile, and modular elasticity, and increasing the abrasion resistance. Now we'll see the coupling agent. What is coupling agent is that the coupling agent binds the filler particles to the resin matrix and allows more flexible resin matrix to transfer the stresses to the stiffer filler particles. Now we'll see the activator and the initiator systems. The composite resin polymerizes by an addition of polymerization mechanism that is brought about by the release of free radicals. The free radicals are released by chemical activation or also by the light activation using the ultraviolet light and the visible light. And the inhibitors are such as the butylated hydroxytoluene 0.01% is added as an inhibitor to prevent the spontaneous polymerization of the monomers by inhibiting the free radical, whereas the optical modifiers or the coloring agents includes the metal oxides in minute amounts so that they produce the different shades of composite. And to provide the opacity to the composite, we can even add the aluminum oxide and the titanium oxide. Now we will see how this composite resins are light cured. The light curing unit such as the QTH curing unit, that is the high intensity quartz tungsten halogen, is used. This produces increased light output to produce the faster curing of the composite resin. But the faster curing may result in less conversion of the monomers in the resin matrix to the polymers. So, this may cause high polymerization shrinkage. So, that's the reason they are now available as different uh, variable intensity QTH light systems. Now we'll see the plasma arc curing light. The plasma arc curing lights contain the two tungsten electrodes separated by the small gap between which a high voltage is generated. And thus the resulting spark ionizes the xenon gas that is present in the environment to produce a conductive gas known as plasma. This unit has a liquid filled light for filtering the harmful wavelengths and transmitting the light of appropriate wavelength to the tip. That's how this high intensity light polymerizes the composite in 6 to 10 seconds. Now we'll see the LED light. The LED light has the blue light emitting diodes emitting a narrow wavelength of the light, which is an absorption range of camphor quinone. So, this also produces a greater outputs like plasma arc curing light. But the advantage in this is that there is no need of filters to produce the blue light. Now we'll see the argon laser curing light. Recently, the lasers are being employed for curing composite resins. The argon lasers emit a blue light at a wavelength of 457 to 502 nanometers, which is suitable for curing the composite. But the advantage is that it will produce the polymerization in an uniform manner and increased degree of polymerization of composite resins compared to the standard QTH units. Now we'll see the different curing modes. We have different curing modes such as the soft start polymerization, which is gradually increases to maximum intensity through the program. That's how it produces more amount of the composite curing, decreasing the polymerization shrinkage. Next, we'll see the three separate techniques for curing. They are the ramped curing, which is the initial low light intensity is applied, which gradually increases over time. Now we'll see the staged curing. In this, the low intensity is applied for determined period followed by light intensity for a certain additional period. And the pulse delay curing is the low energy pulse initially followed by waiting period of 3 to 5 minutes for strain relief, during which the composite is finished and polished. Now we'll see the various composite resins. In the traditional composites are having the fillers about 8 to 12 micrometer size. That means they are large, the macro fillers. The fillers used here are the ground quartz in a concentration of about 70 to 80% by the weight. Due to their several disadvantages, they are no longer used in common use. When used, traditional composites are only employed in stress-bearing class 4 cavities. Now we'll see the small particle composites. The small particle composites have the filler size of about 1 to 5 micrometers, which are midi fillers. But the distribution of the particle size is fairly broad using the heavy metal glasses like lithium, barium, zirconium glasses. They sometimes have the small amounts of colloidal silica also. The small particle composites have improved surface smoothness and superior properties than those of the traditional composites. Now, we'll see the microfilled composites. The microfilled composite resins are developed to overcome the surface roughness and the low translucency of the traditional and the small particle composite resins. The fillers used here are the colloidal silica with a particle size of 0.04 to zero point 0.4 micrometers. Since these particles are very small, they tend to agglomerate to form the long chains. The filler content here is about 50% by the weight and 30 to 40% by the volume. And they provide the smoothest surface finish among the composite resins. They are clinically used for anterior teeth where the need for superior aesthetics has in class 5 cavities and the veneers. Now we'll see the hybrid composites. The hybrid composites are developed to achieve the better surface smoothness than the small particle composites. The hybrid composites have two kinds of filler particles, the colloidal silica and the heavy metal glasses with a filler content of 75 to 80% by the weight. They have the superior surface smoothness close to that of the microfilled composites. And they have the improved radio opacity due to the heavy metal glass fillers. And they have the reasonably good strength. If you observe the clinical considerations is that they are usually suitable for the anterior as well as the posterior restorations due to their superior surface smoothness. Now we'll see the properties of the composite resin. First and foremost, we need to discuss about the polymerization shrinkage in the composite resin. Due to the presence of the resin matrix, the composite resin will undergo shrinkage during polymerization. This shrinkage causes the stresses between the composite and the tooth structure, leading to the composite resin. And this causes the marginal gaps and the enamel fractures as well as the marginal staining with a micro leakage and secondary caries and enamel cracks in internal gap with a post-operative sensitivity. So, thus the hybrid composites shrink only 0.6% while the microfill shrink only 2 to 3%. So, this can be countered for polymerization shrinkage. And also the incremental placement of the composite helps in countering the polymerization shrinkage. Now we'll discuss about the mechanical properties of the composite resin. The flexural strength of the various composites are similar, although the microfilled and the flowable composites exhibit 50% of the lower values when compared to the hybrid and the packable composite due to their filler content. And the compressive strength of the composite are also less in hybrid and the microfilled composite when compared to the traditional and the small particle composite. If you observe the modulus of elasticity, it is also lower for the microfilled and the flowable composites than for the hybrid composite. Now we'll check for the linear coefficient of thermal expansion. The composite resins have higher coefficient of thermal expansion than those of the tooth structure. That means they expand and contract more than the enamel and dentin when subjected to the temperature changes. Thus causes the marginal gaps and also affects the polymerization shrinkage. Now we'll see the wear of the composite resins. The wear of composite occurs while they are in function due to the masticatory forces and also during abrasive foods and the toothbrushing. So, this usually occurs at the contact areas and the occlusal surface. Coming to the water absorption. The water is absorbed by the composite resin, so when the resin content is high, the water absorption is also increased. So the incompletely cured composite resins and those with the strontium and the barium fillers show more water absorption causing hydrolytic degradation. that is nothing but the swelling of the composite. Now we'll check for the solubility of the composite. The water solubility of the composite resins varies from different various composites. An inadequate polymerization causes increased solubility. Now we'll see the marginal integrity. The composite resins exhibit the good marginal adaptations if margins are on the enamel and dentin. But if they are on the root surface, they do not bond well and causes the marginal integrity being poor. We'll see the radio opacity now. The radio opacity is an important requirement for the composite resins, although the resins are inherently radiolucent. The modern composite resins have the glass fillers containing the heavy metal atoms like barium, strontium, and the zirconium, which provide the radio opacity. Now we'll see the aesthetics, color, and the color stability. The composite resins are highly aesthetic and can stimulate the appearance of the natural teeth. They are available in variety of shades, tints, and opaque resins for different applications. If you come to the biocompatibility of the composite resin, the estrogenicity of the composite is exhibited due to the bisphenol A and the bisphenol A dimethacrylate, which is present in the composite resin. However, its effect is very insignificant in the oral cavity.